Perfect. Good. So you guys saw everything?
Yep,
Excellent.
see your
So,
screen.
all right, now we're in business. Sorry, that took a while. Anyway, I am Dr. Kieu Nguyen. Thank you so much for giving me a chance to talk about what I like to do. I've been an ER doctor for 22 years. All right. And I've worked pretty much in San Jose all the time. I started out in Southern California training, and then I've been up here. So I really enjoy what I do, and I'm excited to kind of tell you what I do. If you have any question, just feel free just to chime in. All right, so we'll get going. So I'm going to talk a little bit about what I do, a little bit about training, and then we will end up telling you a couple of fun things that I did as part of ER Doctor. All right. So first of all, what do ER doctors do? We actually take care of a lot of things. We do pretty much everything. We take care of serious, life-threatening, immediate problems. We also take care of people who don't have any medical doctor or any way to get medical care. We're basically jack of all trades. We're always available, and we take care of everybody. So, and why do I do what I do? I enjoy doing my job. My job is very challenging, it's exciting. I get to help people and I get to play detective. Pretty much everybody who comes through the door, I have to figure out what's going on with them because most of the time I've never seen them before. They're not one of my regular patients. So I end up having to talk to them, chat with them, figure out what's going on and why they came to the hospital today. It's a big teamwork. Everybody work together. ER is not a single person thing. You have to work with a team of nurses, technician, other doctors, other physician assistant, and we all play a role together. It's never boring. Every day is a little different. And then what is my typical day? So there's no such thing as a typical day. Every day is completely different. I am what you call a nocturnist. That means I work only the night shift. My time is usually from 10 p.m. until 7 o'clock in the morning. But most ER doctor work all different hours, days, evening, and nights. The ER is one of these things that has always have to be open. We're open 24 hours a day, 7 days a year, weekend, New Year, holiday, we're always open. ER doctor can work in both big cities and rural town. You can basically go pretty much everywhere you want. So how does that work? Usually I come into the emergency department. That is my workplace. My office is the hospital. Patient will either come in either by private car, they'll come in by themselves, their family drive them in, or the ambulance bring them in. I will examine the patient, I will talk to them, order whatever test they need, and then treat them with whatever they need. Sometimes they just need a little reassurance. Sometimes they need to listen, to tests. Sometimes they need some procedures. Sometimes we have to admit them to the hospital. And generally, we try to help the patient feel better. Most of the time, it's pretty much a clinic. You see people with cold, flu. Around this time, you see a lot of people with COVID. A lot of time, the main reason people come into the hospital is pain. They come in because they have headache, they have belly pain, they have different kind of pain. Some other days are way more exciting where people are badly hurt from car crashes, they get shot, they have heart attack, they have stroke. For ER doctors, we need to be prepared to take care of pretty much everything that walks through the door. So this is what a emergency room looks like. I don't know if many of you have ever been in the emergency department. Hopefully not, but this is what it looks like when it's nice and clean, when it's set up in the morning. This is what it actually looks like when it's busy. And you can tell that this is a pre-pandemic picture because nobody's wearing a mask. But it's crazy, people everywhere, they're sitting around, things are happening very quickly. So on an average day, I will take care of both young people and old people. I've had people who take patients who are 3 or 4 days old, and I've had patients who are 102 years old. So every day is a little different. My shift is anywhere from 8 to 12 hours, and I'll work a typical week is about 3 or 4 days a week. ER schedule is not a set schedule. It changes pretty much every month. Take care of a lot of car crashes in this area. We're close to 3 major freeways, so lots of crashes that comes in. I take care of lots of broken bones. We fix broken bone, we set bones in the ER, we put cast and splint on them. I've delivered babies. I've had people who come into the ER, bang on the door, and we come out and deliver the baby in the parking lot, in the back seat of the car. I've had people that come in and they just deliver the baby when they come through the door. So what does it take to go into emergency medicine? After high school, you have to do a college education, 4 years, and that usually to a Bachelor of Science degree. Medical school prefer Bachelor of Science over Bachelor of Art. You can still do Bachelor of Art, but that means you might need to do a little bit more laboratory courses, depends on what you want to go into. And then you have to apply to medical school. Medical school is a 4 years degree. In between college and medical school, you are going to have to study and take what we call the MCAT, which is the medical entrance exam. That's all the medical school use as the score. It's kind of like the SAT for med school. When you're done with medical school, you have to apply to emergency medicine residency training. And that's where the specialized training start, where all you do is emergency medicine. Depends on the program, it can be 3 or 4 years. By the end of the 4th year, you are certified in emergency medicine. So I am a board certified emergency medicine doctor. That means all I do is emergency medicine. I don't do any other kind of medicine. So total of training is 11 to 12 years education to be able to work independently. Right. Any questions so far? Great. So to be an ER doctor, what do you need to have? You have to have a good memory. To be any sort of doctor, you need to have a good memory because the majority of your learning is going to be reading book, memorizing, remembering what kind of symptoms or illnesses, and bringing it up quickly. You have to have good reading skill. You have to have good math skill because a lot of time when you do medication, it's weight-based. So someone come in who's 35 pounds, that's 12.5 kilo, and you have to calculate the weight. If you want to give them medication, how much do you give? So you have to do pretty fast math. The other important thing is you have to be good at changing speed and you have to work fast because the emergency department is always changing. If you're not into fast pace, ER may not be for you. You will do great being an internal medicine doctor, a family practice doctor where you have time to sit down and chat with the patient. ER might not be the right thing because a lot of time when I come in, I'll be talking to one patient, they'll page a code overhead and have to say, I'm sorry, I'll be right back. And you have to change gear and go down and see something else. You should be good at using your hands. You will be doing a lot of detail work. You're stitching up people, you're fixing up broken bones, you're doing life-saving procedure. And you really should not be afraid of blood because you're going to be seeing a lot of blood. All right. In this area, it helps to speak more than one language. If you're going to be working in metropolitan area, I work in San Jose, so I speak a little Spanish, I speak a lot of Vietnamese, and I speak English. So with the 3 of them, that should be pretty good to get me going at night. You need to be in fairly good shape. You don't have to be an athlete, but you are going to be standing and walking a lot. I have the Apple Watch, and pretty much every night when I'm working, I walk about 8,000 steps. So it's a lot of walking back and forth, going to different rooms and walking in to see people. Okay. So emergency medicine is one of the tougher programs to get into. Nowadays, medicine is hard to get into, but emergency medicine is one of the more competitive program to get into. Most doctors need to do well in medical school to get accepted to a ER training program. Training with any medical training is expensive. The cost of college and medical school tuition is usually anywhere about 20,000 to 40,000 a year. So you're multiplying that by 4 years of college and then 4 years of med school, you're coming out with a pretty big bill. But there are a lot of things to help you. There's student loans, the government program, there's a lot of things that will help. So don't let the cost turn you off from going into emergency medicine. The reward is wonderful. I have pretty great job satisfaction. Pretty much as an emergency medicine doctor, you run the emergency departments. You're basically your own boss. You can work as much or as little as you want. The income is very good. In this area, most ER doctors' starting salary is about $250,000. Usually you start out at $250,000 a year. If you work in a big city, if you work in San Francisco, you work in New York, your starting salary is more going to be about $300,000 a year. So you spend a lot of money training, but your income is pretty good. Also, emergency medicine is one of the rare fields where, as a woman, your income is not based on your race or your sex. You know how a lot of different jobs, if you're a woman, you're discriminated against, you don't earn as much as a man. For ER, how much you earn is based on your experience and how hard you work. Sorry about that. My dogs are going a little wild, but. And then the other nice thing is you feel like you're helping people pretty much every day when you show up to work. All right. So what does it need to get into medical school and to get into ER? So for medical school, well, overall, medical school, college, you need to get good grades in high school, especially in the sciences, the biology, the chemistry, the physics, because those are the basic of your field. It helps if before you enter medical school, you volunteer in the medical field. You can always volunteer to work in a hospital, the clinic, go to the local hospital, trying to get, a volunteering job, kind of walk around. You want to be a well-rounded person. Do more than just study, because it will help you be a better doctor and to relate to your patient better. All right. So Leslie, I notice that 2 people are entering the waiting room. Are you letting them in or am I doing that?
Oh, I think because I made you host, you have to
Okay.
let them in.
Okay, let me see how I do that. Sorry, I have not done this. I don't want them to miss out anything. How's that?
Yeah, I think that's good.
All right, welcome. We are back. Okay. All right, we'll continue. So that is the normal way people get into emergency medicine, right? I did it a little different. I didn't take the typical way. So I actually started out being an engineer. I actually started out at UC Berkeley. All right, let me add some more people. Actually, Leslie, do you want to take back the host, or do you still want me to do this so that way I can just talk and you can?
I can take back the host, but if you can't share your screen because of that, then you can be host again.
Okay, so let's just see how this works. How do I get you to take back the host?
Oh, okay. So you go down to participants and you click
Yes,
on the people icon, and
got it.
then yeah.
No, what did I do? Sorry, let me stop the sharing for a second because the screen is doing funny thing. Okay, participant.
If you hover
Uh,
around my name, I think
yeah,
there's like an option where you can like make me host.
make host. There we go. Good.
Yeah. Okay. Is it possible that you can still share your screen?
Yes.
Okay, great, great.
All right, now we continue. Sorry about that. So, okay, so let's get back. So I started out being engineering. I was doing engineering at UC Berkeley, and then my aunt got sick. I took off for a little bit of time to help take care of her, and I actually enjoy being going in and out and seeing the medical stuff. So I went back and finished all my engineering courses. I did an extra year of lab courses and applied to med school. I was lucky enough to get into UC San Francisco. So I was there for 4 years. After UC San Francisco Med School, I applied to residency and I went to Loma Linda Medical Center. That is in Southern California. And I was there for 3 years training. Afterward, I came back and right now I am working at several different hospitals. My main hospital is Good Samaritan Hospital in San Jose. I also work at El Camino Hospital up in Mountain View. And then I have a couple of part-time jobs at O'Connor Hospital over in near Santana Row. And then one of my tiny little hospital is down in Gilroy, St. Louis Regional. So as I said, ER doctor, we can work anywhere. We can have several different jobs. It's exciting and you can do more than just working in the hospital. That's the good part. The bad part is the ER is open 24 hours a day, 365 days a week. So that means ER doctor works pretty much all the time. Is the hours crazy? You work a lot of weekend, you work a lot of holidays. So I get one major holidays off this year, and then the other two holiday I take turn working with my partner. At work, most of the time is continuously running. We are not going to be sitting around chit chatting. You're going to be seeing patient pretty much all the time. And then sometimes it's hard that you cannot save the patient. Some people come in really sick, and it doesn't matter what you do, you cannot really save them. With the pandemic, there's definitely more challenges. So as frontline worker, we have major risks of getting COVID infection just because you're the first one seeing the COVID patient. Early on, we didn't have enough masks, gloves, supply. Now it's much better. There's always those annoying entitled patients that come in and they don't want to wear masks. And I actually has one patient that came in and said, I want to be in a room where there's no COVID. And I asked her, what do you mean? And she said, I want to be in a room where there's never been any patient that had COVID. I just looked at her and go, ma'am, we're 2 years into COVID. What the heck are you talking about? Right. So, and then nowadays with COVID, there's really not a whole lot of good treatment. So you can support, you can help them feel better, but there's no real major treatment. All right. So this is me most day. So you're basically masked all the time. When you get a sicker patient, we have to do more cover up. When I know I'm seeing a full COVID patient, this is where the space helmet come in. So that thing is an entire air filter that you wear that got the vent behind you. I have a little package that I wear behind the waist that you can't see it under the yellow gown, but it pumps filter air into that helmet. So it depends on what you see. You have to wear a different thing. All right. The nice thing is, especially working down in Gilroy, we take care of a lot of farmers. One of the farmers came in and brought us just boxes and boxes of ripe strawberry to say thank you. So it's very nice to get the instant satisfaction, and they come in and being nice, and they want to thank you by giving you fresh fruit and stuff. Okay, any question at this point? Great. Now we get to talk about what the fun stuff, what else can you do as an emergency physician? I'm going to be showing pictures about our emergency medicine trip and overseas trips and stuff that I do on the side instead of just working in the hospital. Right. So one of the big things that I used to do a lot, and I'm still doing, is international medicine. For ER doctor, we're very well trained. We're trained in delivering baby, surgical procedure, taking care of kids and adults. So we can go overseas and we can help in disaster and emergency medicine. So if you heard about a recent earthquake in Tonga, a lot of the ER doctors are over there helping. When they had the big disaster in Haiti with them, and then when they had the volcano that erupted in the Philippines, a lot of the ER doctors were there helping and taking care of people. So this was many years ago before I had kids. My husband, as he got right in front of me, went with a group of doctors to Vietnam. So we were working, taking care of patients there. This is a lady with a stroke, and we were teaching the family how to do physical therapy, making sure that she move her muscles so she doesn't get stiff. I actually work as a part-time surgeon there. We were helping taking care of little kids with cleft palates. And you can see these are many of the pediatric patients that we operated on. We fixed their cleft palates and their deformed nose and mouth, and they came back and gave us flowers. Okay. This is one of my friends. She has, you can't really see it very well in this picture, but her eyes are kind of like a hazel green. And the Vietnamese kids and the Vietnamese woman in that area were so fascinated with her because they'd never seen anybody with green eyes. So she's a very popular person. Every day they come over, they're showing her a picture, and she's showing them a picture of her family in Canada. All right, so this is our group for that year. A lot of American doctors are working with the Vietnamese doctor, helping to take care of people. Okay. And then just recently, right before the pandemic, I actually went to El Salvador and I brought Amy, my daughter, with me. This is a big group of doctor, nurses, EMT. We worked for a week and we saw about almost 3,000 patients. And then we took some time to travel and to play afterward. So we left for San Francisco airport at like 3 o'clock in the morning because the flight out was at 5 in the morning. This is what El Salvador looks like on a plane. That's in the back is a volcano. The volcano is still active. It hasn't erupted in about 200 years, but it's still active. This is what the houses and everything looks like. So the missions is sponsored by the church. And so we leave the hotel we have to wake up at 5 in the morning. Breakfast is at 5:30 in the morning. We have to be on the bus at 6 o'clock in the morning, and it's like an hour ride out to the village. So we stay in the capital city, and you take the bus for an hour out to the village. These are the nurses, the staff to take everybody. Once we get there, you set up in the church, and then everybody get the job for the day. These are my colleagues. So we have El Salvador doctors, American doctors, and we all got together and we worked together. So the patient get bussed in from the villages, and they get a number, they sat down, they very patiently wait for us to see them. And you can see, we see adult, we see kid, we see pretty much everybody. They're all very happy to see us because in the villages, they usually don't have the money or the facility to go see a doctor. So when they see a doctor, they get really excited. So Amy and the daughters and sons of the doctors, we put them to work. So they were, you can see free glasses that we got. We gave them out to a lot of the people. They were runners. So Amy initially worked as a register. So she used some of her Spanish and talked to the people and got them registered for visit, like ask and put in basic information and question. And then we put her to work being a pharmacist. So she was packaging medications for us too. We brought all of these things. So all the medication, all the equipment, we all packed and took them with us. This is what the clinic looks like. This is basically the house of the church person, and they moved out and we just used all the bedrooms and all the room as exam room. Yeah, so the patient were not so happy to be there, but overall, they're all very happy. It felt like we were helping a lot of people. Like little old lady were very happy to see us. This little lady, you see the stick that my friend Carlos was holding? She couldn't really walk. She doesn't even have a cane. What she used was the broomstick that she was using for a cane. And we went and got her a real cane and she was extremely happy. This lady, actually, Amy helped me do a little surgery procedure on her. And at the end, she was so happy. She was saying that, you know, she's very grateful to all of us being there because no one has even talked to her about doing the surgery before. And we just kind of got it done in one day. Lots of kids, they're all very happy to see us. Right. This lady is really cute. She has never seen an Asian person before. So she wanted to take a picture. And then these three kids love my daughter. They, again, have not seen an Asian person before, so they were following Amy everywhere and they wanted to take a picture with her. Okay. So this is a picture of part of our group. Yeah. At the end, they had the schoolgirls. They came over and they did like a little dance performance for us. So that was very nice. And then after that, we went sightseeing. This is called a Rainbow Church. It's a church in El Salvador that has stained glass window. And you can see it's all different rainbow colors shining through. We went to a Mayan ruin. And this was in about 30 kilometers east of San Salvador. So these ruins were around the time Columbus came to Central America. So this is close-up of a skull of the royalty. So back then, if you are royalty, they drill a little hole in the teeth and they put jewels in there. So you can still see one little black onyx in there, all the other jewel fell off. And then of course we did shopping. And this is a coffee shop across from the volcano that I showed you before. And lots of food, different food. Oh, for those of you who drink Starbucks, this is what coffee beans look like. We went to a coffee farm, and this is what coffee bean looks like before it gets processed. So part of ER is you get to go work. You also get to go meet the people, go play. And then the other fun part, I don't do this anymore, but we used to do search and rescue. Search and rescue, you would be on helicopter, going out there, helping people. So this is a Marine Black Hawk helicopter. When I used to work at Regional Medical Center, that was one of the hospitals in the area that has a landing pad strong enough for the Marine helicopter to come. So they would be coming to see us a couple of times a year when they have someone who is sick that they rescue from the sea. This is just me hanging out with them. Another view of the helicopter flying. This was many years ago. My kids actually get to come in and sat in there and hang out and see what the helicopter is doing, trying out the equipment and trying out the pilot. So, other perks to be an ER doctor. You are very popular with your friends and family. Everybody needs a doctor. And a lot of time, I'm the one who call when they can't reach their own doctor. Once in a while, you get to take care of famous people who gets hurt and have to come to the ER. I've taken care of the ex-mayor of San Jose. I've taken care of a movie star. I've taken care of a ex-NASA astronaut. And just recently, I've taken care of a pretty well-known musician that I can't tell you the name, but they come into the hospital because famous people get sick too. So what is the future of emergency medicine? Emergency medicine is one of these fields that you will never worried about not having a job, because as an ER doctor, you will always be in demand. The reason is most ER doctors don't work that long. We usually retire about 60 years old. So they're always going to need young people to come over, take up the mantle, carry out the work. After you retire from emergency medicine, you can always go into teaching. You can do clinic work. You can do a lot of different things. You can travel. You can do international medicine like what I've been doing. And you always win I have the coolest job contest among your friends. Any question?
I have a question.
Sure.
How often do you travel, and do you need to know like the language of the area?
So that's all up to you. The nice thing about emergency medicine is you can pretty much ask for time off if your friends can cover for you. When I was much younger and before COVID, I would do a trip out of country pretty much once a year for about 4 or 5 years. I stopped when I had kids, and then last year I started again. Sorry, 2020 I started again. Last year we were gonna go, and I was gonna bring my other children with me, but COVID happened, and then this year with COVID we're still not going. But for an emergency medicine doctor, the limitation is your time. If you can take the time off, you can pretty much go anywhere and wherever you go. There are trips happening every month of this year from different organizations. In terms of speaking the language, you don't need to. I speak a little Spanish, so I was doing okay, but we had, wherever you go, if you go with a good group that provide for you, they have translator. And in El Salvador, we have about 20 different translators. We ended up being good friends with them, went out to eat with them, and traveled the city with them. So that's not a problem.
Oh, okay, thank you.
No
I also wanted
problem.
to ask, you talked about how you had crazy work hours. Do you ever get to like choose like preferences on your work hours? Like if you'd rather work during the day or night?
So it depends a lot on your group. Um, Most group, you're gonna have to, unless you choose to be working all night, nobody's gonna take the night shift from you because the night shift is the least favorite shift of most people. So if you do night shift, you're gonna be doing night shift. Nobody's gonna take that from you. But if you come in for ER is going to be a rotating shift. Most of the time, you cannot have only day shift or only evening shift or only afternoon shift because that's not fair to the rest of your partner. So with ER, pretty much you're going to be rotating through. You're going to have one person making the schedule. And let's say you work 12 shifts a month. 4 of them are probably going to be day shift, 4 of them is going to be afternoon shift, 4 of them is going to be evening or night shift. In terms of weekend, what we do for my group is we put in requests 3 months in advance. So 3 months in advance, you pick the weekend that you want to be off, or if the time that you really want to be off, you ask for it off. Most of the time, if you have a big enough group, most of the time you have your time off. Like for me, for important days like birthday, vacation, things like that, I would get them off because I asked for it in advance. If it's like last minute, someone want to go on vacation, most of the time I won't be able to go because the schedule is set and it's going to be really hard to find someone to work for you. So that is one bad thing about ER is the scheduling's a little crazy. It's not like When you have a clinic and you have your office, you come and you work from 9 to 5 and you close at night and you close on weekend. ER is not like that.
Oh, okay. And then I had one more question.
Sure. Any question,
Um,
I'm here for.
does it ever get like overwhelming on the job, especially when you can't help the person?
So that's one thing they have to learn. You have to learn to kind of take a step back and don't get too invested, because there are people that will die. I used to work at the trauma center at Regional Medical Center, and Regional Medical Center is tough because what happened is you see a lot of trauma. And with the trauma, people come in, and a lot of time they're young people. I've seen people like teenagers who get shot and we can't save them. So it's tough. If it's an old person to come in, it's a little bit easier if they die. But the thing that's tough on me is little babies. I've seen kids who got abused and come in and die from abuse. I've seen young people who get shot and they come in and die from being shot. So that is the tougher part.
Okay, thank you.
I have two questions.
Sure.
Is it okay? Can you tell us like the weirdest case you've ever gotten? Like the weirdest case someone has come into the ER?
People always ask the weirdest and what's the most gory cases. So when I was down in Loma Linda and the kids heard about this, I had a couple of teenagers who decided that they were drunk and they caught a little baby rattlesnake, and they decided that they were going to kiss the rattlesnake. So the snake, being snake, kissed him back, bit this guy on the tongue. And he was drunk and he was high, and his friend just kind of sat on him for a while. By the time they figured out he was in trouble, he brought him to the ER. His tongue was swollen and hanging out, and he could barely breathe. And that is one of the cases where you basically have to run in and do something immediately. So we basically had to cut his throat open, put a breathing tube in to help him breathe. He ended up losing the entire anterior third of the tongue. He lost the lips. He lost like most of the jaw, and they have to have a lot of reconstruction. So that is my most memorable case. My funnest cases are always the baby delivery, because they're exciting and they happen really quickly. I've had a guy that came banging on the ER door to say, "Baby coming, baby coming." So I come running out, and his wife is in the back seat of the car. And I basically jump in there, deliver the baby, and this is in the parking lot. So about 30 people were standing around just watching. And we're busy delivering baby. We're not paying attention. We pull the baby out, the baby start crying. All 30 people start clapping. And they turn around like, "Oh, not much privacy." Yeah. So delivering baby is always fun. And once in a while we have to do that.
And my next question is, how did you know that you wanted like specifically emergency medicine and not like pediatrics or like
Right.
general?
Right. So once you're in medical school, part of the medical school, what it does is they rotate you through different rotation, right? They go through different thing, and every rotation you do something. You're going to be doing surgery 1 month, you're going to be doing medicine 1 month, you're going to do pediatrics 1 month, and it's going to come to you what you feel like doing the most and what you feel like the least. For me, psychiatry was my least favorite. I just did not like it. I did not feel like I want to sit there and just talk to people about their problem. Um, I like the excitement. I probably would have been a surgeon if I had met Happy Woman Surgeon. When I went to school at UCSF, the woman surgeon were not happy. They were overworked and they were always hardworking. So when I went to emergency medicine, first day I walk in, one attending said to the other, "Hey, dude, I'm going up to Tahoe next weekend. You in?" And he go, "Oh, I got a bike ride, but I'll meet you there." I'm like, lifestyle, fun. Okay, I'm there. So emergency medicine for me, I like procedure. I like the excitement. I like to work with my hand, so it fits in perfectly. And most people, you will figure out what you like. That's what medical school is for. You're gonna go rotate through all uh, different field, and something will call out to you.
Thank you. Does anyone else have any questions?
Yeah, it's too bad with the COVID thing. We cannot have anybody follow us around, because before we used to have high school students come and do like some shadowing in the ER, just kind of walk through for a couple of hours and see how things look. But right now we're not having volunteer, we're not having any shadows, anything. So
Yeah, I have a question.
sure.
So, when you're in high school, did you do any internships or programs that you're interested in?
So when I was in high school was so long ago that everything has changed. I was in high school in the 1980s. Um, I volunteer at the local hospital. I also work as a receptionist for one of the local doctor. But back when I was in high school, there was not as many programs available as it is now. So now you guys have a lot more option. You have more like things like this where I can come and talk to you. Back when I was in high school, it was not a whole lot. You kind of have to went out of the way to get stuff. Also, when I was in high school, I thought I was going to be an engineer, so I didn't really look that much into the medical stuff.
Christy Ann said, what is the most common case you have handled in the ER?
Most common thing that we see is abdominal pain. If you look at everything that comes through, abdominal pain is going to be the most common complaint, because if you have a cold, if you have a flu, you can wait and see your doctor. If you have a belly pain and you're throwing up, you're going to want to come into the ER. So most common case that I see is actually abdominal pain.
And with that abdominal pain, what does it usually turn out to?
Most of the time is just we don't know. A lot of time it's just belly pain. Sometimes it's kind of like food poisoning. Once in a while, people get appendicitis. They have gallstone infection. So those are what I see the most. At night, I see a lot of kids with fever because the parents work during the day, and then they come home, the kids get sick, and all day they've been at the babysitter, and then they take them in at night. Once in a while at night, I get heart attacks, and those are the one that we have to jump on and do quick stuff. But most commonly, the abdominal pain, a lot of times you don't really know what it is. You just kind of make sure that it's not anything bad.
If no one has any other questions, I think, yeah, it's almost 6 o'clock, and I think that we can just end this meeting. Thank you, Dr. Nguyen, for coming in and telling us about your career and about emergency medicine.
Oh, thank you for inviting me. I love talking about emergency medicine. I just wish you guys have a chance to come hang out in the ER and see what it's like. But you're starting on your career. So first step is getting to a good college and then getting to med school. Good luck to everybody. I think you guys are all going to do great. And if you want to go into emergency medicine, come work, replace me when I'm retired. That'll be awesome.
Thank you everyone for coming to the event. We will now end the meeting.